Cholesteatoma. A cholesteatoma is an abnormal, non-cancerous skin flaw that can develop in the middle section of your ear behind the eardrum. A cholesteatoma often develops as a cyst or shaft that sheds layers of old skin. As these dead skin cells accumulate, the flaw can intrude inside and destroy the delicate bones of the middle ear. 1. Primary acquired cholesteatoma occurs when the ear doesn't drain or doesn't even equal out pressure properly. Eustachian tear. This improper drainage and pressures pulls the eardrum into the middle ear, allowing cells to collect. 2. Secondary acquired cholesteatoma develops when skin cells collect behind the eardrum after a rupture. 3. Congenital cholesteatoma forms when skin cells become trapped in the middle ear before birth. It is very rare. You may face a higher risk of cholesteatoma if you experience 1. Recurring ear infections. 2. A ruptured eardrum. The symptoms associated with a cholesteatoma typically start out mild. They become more severe as the cyst grows larger and begins to cause problems within your ear. Vertigo, facial muscle paralysis, and permanent hearing loss can occur if the cyst continues to grow unchecked. To determine whether you have a cholesteatoma, your doctor will examine the inside of your ear using an otoscope. An ear, nose, and throat specialist, otolaryngologist, performs an advanced evaluation. 1. Hearing test. Test to check for hearing loss. Audiogram to assess your eardrum, middle ear, and hearing. 2. Imaging test. CT scans of the ear, which helps see if there is damage to the ear bones, or MRI if there is a concern that the cholesteatoma is spreading through the skull base. Cholesteatomas don't go away naturally. Generally speaking, the only way to treat a cholesteatoma is to have it surgically removed. Cholesteatoma treatments almost always need surgery, but to treat the concurrent infection, it may include antibiotics to get rid of infections, ear drops to slow ear redness. Once the cholesteatoma is removed, you need to attend follow-up appointments to evaluate results and ensure the cyst hasn't come back. Congenital cholesteatomas cannot be prevented, but parents should be aware of the condition, so it can be quickly identified and treated when present. It's important to treat cholesteatomas as early as possible to prevent complications. Call your doctor right away if you believe you have a cholesteatoma. Thank you very much.